Have you ever wondered why sleep is so crucial to our health and well-being? It's a question that deserves some pondering, as sleep, often overlooked, plays a fundamental role in our lives. Sleep is not merely a passive state where we switch off our bodies and minds for a few hours. In fact, it's a dynamic process where our bodies perform crucial functions necessary to maintain optimal physical and mental health. During sleep, our bodies are hard at work. Physically, sleep gives our bodies the much-needed time to repair tissues, grow, and even synthesize hormones. It's during these quiet hours that our bodies recover and rejuvenate, preparing us for the day ahead. Beyond the physical, sleep is equally vital for our mental well-being. While we're nestled in our dreams, our brains are busy processing and consolidating the information we've gathered during the day. It's during this time that our memories are strengthened and our learning is solidified. So when we're sleep-deprived, it's not just our bodies that feel the fatigue. Our cognitive functions like attention, decision-making, and problem-solving abilities also take a hit. Now, imagine consistently missing out on this restorative process. A lack of sleep, whether it's due to lifestyle choices or an inability to sleep, can lead to various health issues, from increasing the risk of heart disease and diabetes to impairing immune function and even contributing to mental health disorders such as depression and anxiety. The consequences are far-reaching. This brings us to the realm of sleep disorders, conditions that prevent us from getting quality sleep. With a range of sleep disorders out there, it's important to remember that sleep is not a luxury, but a necessity. Sleep disorders, while they may seem daunting, are not insurmountable. The key lies in understanding them and their effects. This understanding is the first step towards better sleep hygiene. And the journey to better sleep hygiene begins with recognizing the importance of sleep in our lives. Understanding sleep disorders and their effects is the first step towards better sleep hygiene. So let's delve deeper to understand these disorders and how we can overcome them one night at a time. One of the most common sleep disorders that people suffer from is insomnia. The word insomnia itself is derived from Latin, meaning no sleep, and it's as exhausting as it sounds. Insomnia is a condition marked by persistent difficulties falling asleep, staying asleep, or both. It's like a stubborn bolt that refuses to lock you into the world of dreams, leaving you tossing and turning in a sea of wakefulness. Let's delve into the symptoms. Insomnia often manifests in a variety of ways. You might find yourself lying awake for hours, your mind racing with thoughts. You may wake up multiple times during the night, or wake up far too early, feeling as if you've just run a marathon rather than spent a night resting. And when morning comes, you might feel tired, irritable, and unable to focus, as if a fog has settled over your day. The causes of insomnia are as varied as its symptoms. Stress and anxiety are common culprits, their relentless chatter often keeping us from the peaceful silence of sleep. Other times, it can be due to medical conditions, certain medications, or even something as simple as consuming caffeine too close to bedtime. But it's not just about a few restless nights. Chronic insomnia can lead to a multitude of health risks. It's like a domino effect. Poor sleep can lead to mood disorders, impair memory and cognitive function, and even increase the risk of heart disease and diabetes. It's a silent invader, slowly but surely chipping away at your overall health. That said, it's important to remember that insomnia isn't a life sentence. There are treatment options available, from cognitive behavioral therapy to medication and lifestyle changes like establishing a regular sleep schedule or creating a calm, sleep-friendly environment. Insomnia can significantly impact your quality of life, but it's not the only sleep disorder you should be aware of. So let's continue unraveling the mysteries of sleep, peering into the world of other sleep disorders to better understand our nights and improve our days. Another common sleep disorder is sleep apnea, which can be quite serious if left untreated. Sleep apnea is a disorder characterized by repeated interruptions in breathing during sleep. These interruptions can last anywhere from a few seconds to a few minutes and can occur as frequently as 30 times or more in an hour. When normal breathing resumes, it's often accompanied by a loud snort or choking sound, startling the person from their sleep. Now, there are two main types of sleep apnea: obstructive and central. Obstructive sleep apnea, the most common form, is caused by a blockage of the airway, usually when the soft tissue in the back of the throat collapses during sleep. Central sleep apnea, on the other hand, occurs when the brain fails to signal the muscles to breathe. Symptoms of sleep apnea include loud snoring, episodes of breathing cessation during sleep, abrupt awakenings accompanied by shortness of breath, dry mouth or sore throat upon waking, and excessive daytime sleepiness. The causes of sleep apnea vary. It can be due to excess weight, thicker neck circumference, being male, being older, family history, use of alcohol, sedatives or tranquilizers, smoking, or nasal congestion. The potential health risks associated with sleep apnea are significant. They include high blood pressure, stroke, heart failure, irregular heartbeats, heart attacks, diabetes, depression, worsening of ADHD, and even headaches. The seriousness of these risks underscores why it's so crucial to get checked if you suspect you have sleep apnea. Treatment options can range from lifestyle changes, such as losing weight or quitting smoking, to therapies like continuous positive airway pressure, CPAP devices, or even surgery in certain cases. In conclusion, while sleep apnea might initially seem like a simple nuisance, its potential to cause severe health problems means it's something we should take seriously. Regular and restful sleep is a cornerstone of good health, and understanding sleep disorders like sleep apnea is a key part of that. Sleep apnea can be a dangerous condition, highlighting the importance of understanding and addressing sleep disorders. Narcolepsy and restless leg syndrome are two other sleep disorders that are less common but still impactful. Let's begin with narcolepsy, a neurological disorder that affects the brain's ability to regulate sleep-wake cycles. Individuals with narcolepsy often experience excessive daytime sleepiness and sudden, uncontrollable bouts of sleep that can occur at any time. Imagine being mid-conversation with a friend or driving a car only to suddenly fall asleep. That's the reality for people living with narcolepsy. Apart from these sleep attacks, other symptoms may include cataplexy, a sudden loss of muscle tone often triggered by strong emotions, sleep paralysis, and hallucinations. The exact cause of narcolepsy isn't entirely understood, though it's believed to involve a deficiency in the brain chemical hypocretin, which plays a key role in regulating wakefulness and REM sleep. Now, let's shift our focus to restless leg syndrome, or RLS. This is a neurological disorder characterized by an irresistible urge to move one's legs, especially during periods of rest or inactivity. The sensations experienced can range from mildly uncomfortable to downright painful, often described as crawling, creeping, pulling, or even itching. These feelings can disrupt a person's sleep, leading to daytime fatigue and a reduced quality of life. The causes of RLS are not completely known, but it's thought to be linked to an imbalance of the brain chemical dopamine, a substance involved in controlling muscle movement. Other factors, such as pregnancy, iron deficiency, and certain medications, can also trigger or worsen RLS symptoms. Both narcolepsy and RLS can lead to serious health risks if left untreated. Apart from the obvious dangers of suddenly falling asleep during activities like driving or operating machinery, narcolepsy can cause difficulties at work or school and even lead to depression. Similarly, the chronic sleep deprivation caused by RLS can contribute to mental health issues, cardiovascular diseases, and a diminished quality of life. These disorders, while less common, can still greatly impact someone's life and well-being. Now that we understand these sleep disorders, we can see the value of good sleep hygiene. Sleep hygiene, in essence, is a variety of different practices and habits that are necessary to have good nighttime sleep quality and full daytime alertness. It's like brushing your teeth or washing your hands, simple, everyday habits that significantly impact your health. So what does good sleep hygiene look like? It involves a range of habits. Going to bed and waking up at the same time every day is a good start. This helps regulate your body's internal clock and could help you fall asleep and stay asleep for the night. Avoiding naps, especially in the afternoon, can also help. While power naps can be beneficial, long or irregular napping can negatively affect your sleep. If you feel you must nap, limit it to about 20 to 30 minutes and make it during the mid-afternoon. Physical activity can help you sleep better too. Regular physical exercise can help you fall asleep faster and enjoy deeper sleep. Timing is important though. If you're struggling with sleep, try to finish exercising at least 3 hours before bed. Your diet plays a role in sleep as well. Avoiding large meals, caffeine, and alcohol close to bedtime can improve sleep quality. These can cause discomfort or withdrawal symptoms that may disrupt your sleep. Lastly, creating a restful environment can significantly enhance sleep quality. This might mean keeping the room dark and quiet, investing in a comfortable mattress and pillows, or keeping the room at a cool temperature. By maintaining good sleep hygiene, you can manage and even prevent some sleep disorders. For instance, regular sleep schedules and a restful environment can help manage insomnia. Regular exercise can help reduce symptoms of restless leg syndrome. Good sleep hygiene is vital for everyone, whether you have a sleep disorder or not. It's time to prioritize sleep and ensure you're giving your body the rest it needs.